Hello, how are you this afternoon? I'm Dr. Diana Chavkin. Thank you for tuning in. Today we are going to talk about getting through the fertility process, maintaining hope during a process that can have a lot of challenges along the way. You know, it's interesting, we call this a journey, and I think we call it a journey for a lot of reasons. There are a lot of things that happen in this process. A lot of medical things, so a lot of blood draws, a workup, medications that need to be taken, ultrasounds, there's different medication protocols, there's different paths. So sometimes we'll recommend a specific workup or potentially a surgery, insemination, or an IVF process, and we don't always know what's going to happen at the end of these processes. And I think that's why we call it a journey. Just like in a journey, when you go and you don't really know what's going to happen along the way or necessarily how it's going to end, but you just keep moving along, keep going through the steps, and hoping for the best and staying positive. I think that, you know, the tricky part about this, I always tell people, is that you know, you need to stay positive. You need to have hope, because if you don't, it really is very hard to put one foot in front of the other. It's hard to come in for the ultrasounds, to get up early in the morning before work and then stay tuned for the instructions. You never really know necessarily when your retrieval or your insemination is going to be. You don't know the results of your blood work. And so you don't really know what's going to happen, and it's hard not to have control over these things. But it is really, really important to put one foot in front of the other. And I think it's almost impossible to put one foot in front of the other and to do all of the things that we ask our patients to do if the patient doesn't have hope or is not positive. So I think that that's really important. But it's also a balance, because we don't want to say, you know, have hope and be positive because it's all going to work out and you're definitely going to get pregnant with XYZ treatment. We don't know. We can't tell the future. We don't have crystal balls. But again, I think it's important to stay positive so that, you know, we put one foot in front of the other, and if for whatever reason a specific treatment doesn't work, it doesn't mean that another treatment won't work. And so maintaining positivity throughout, I think, really helps people get through the process. I think speaking to a specific mental health professional who focuses on fertility is really important. I think, you know, a lot of my patients are already seeing, let's say, social workers or psychologists or mental health people, you know, generally in life. And I think that's great. But I do still recommend a lot of the times that people speak with specific mental health professionals who focus on fertility, because this is a very unique situation, a very unique journey. I think one of the really important things to think about when thinking about fertility treatment and maintaining hope is that we don't always know, or we really never know how something is going to work out. And sometimes when we think that something is a negative outcome, it can actually be positive. So, you know, I actually personally went through fertility treatments multiple times. All of my 3 children are through IVF. And in one of my experiences and one of my portions of my journey, I was going through the process of creating embryos. And at the time, while I was in the middle of my stimulation, lo and behold, we found that I had a polyp. And because of that polyp, I said, oh, okay, I guess now we can't do a fresh transfer. And this was over 10 years ago when we thought, you know, fresh transfers were better. So I thought, oh, this is a terrible situation, a terrible outcome. Now I have to freeze my embryos, you know, then do my hysteroscopy, and then I can go forward with my fresh transfer. Well, because of that cycle, I had to freeze some embryos, then had my hysteroscopy, had my polyp out, and then did a fresh cycle. That polyp is the reason why I did my subsequent cycle, and that subsequent cycle is the reason I had my first child. And when I think back to that whole scenario, it's just so interesting to me that at the time I thought this polyp and this hysteroscopy was such a huge bump in the road, such an annoyance, gonna, you know, affect the fresh cycle that I had wanted. But because of that, that's the only reason I had the first child that I actually have right now. And then I actually went on to use the frozen embryos that I used from that first cycle that I had to freeze, and that's my second and third child. And it's just so interesting how it worked out. at the time, like I said, it was to me, it was a very sort of negative situation, but I look back and it actually was positive. And I think that goes out for, for a lot of things. We sometimes are in the middle of the journey, in the middle of the situation, and we think something is negative, but if we, keep going to the next point in time, that we can look back and say, actually, that was positive. It's almost like a kind of a Buddhist way to kind of approach things, that, we never really know what the ultimate outcome is, whether it's good or bad. I think we just kind of have to go through the process, and a lot of times what we think is negative can actually be positive. So I think with that, I'll kind of take a break and see if anybody has questions. I will say, this is not easy. This is not an easy process to go through. I don't think anybody thinks it is. And I think in any ways that people can find support, find the right support. People who are going through this sometimes don't want people to know, just because they don't want that extra stress. And I think that should be respected. I know that when people go through this, there's a lot of things that people say that can be triggering. Some people don't know necessarily that you're going through fertility treatments, and people can be like a little bit callous sometimes with things they say, and they don't realize kind of what you're necessarily going through. I think surrounding yourself with things that don't trigger you, with things that make you feel supported, looking out for specific support groups. There are tons of amazing resources. I think one of the things I usually do recommend against is kind of going on Google and sort of, searching there for support. I think that, a lot of times there can be misinformation, there can be triggering information. And so I think finding the appropriate support groups, appropriate support people is really, really important during this journey. Okay, any questions? And don't have any questions right now, that's totally fine. Feel free to reach out to our office. Happy to speak with you in person or on a telehealth visit. I really appreciate you guys, for those of you who checked in today. Look forward to connecting with you, hopefully, and really wishing you all a beautiful, beautiful day. Thank you.